In the heart of Rivers State, three monumental projects, each with the power to transform lives, came under the spotlight as the Honorable Minister of Regional Development, Engineer Abubakar Momoh, FNSC, led an inspection tour alongside the Permanent Secretary, Dr. Mary A. Ogbe, the Managing Director, CEO of the Niger Delta Development Commission, Dr. Sam Oboku, Executive Directors and senior officials of the ministry. The first stop was the Ka-Ataba Road and Bridge. The journey began at the Ka-Ataba Road and Bridge, a lifeline linking Kana and Andoni local government areas. This project was a story, one marked by years of abandonment and dashed hopes. For decades, communities on either side have been separated not just by water, but by isolation, costly transport, and limited access to markets and basic services. Today, under the renewed drive of the federal government and with the NDDC steering the works, that narrative is changing. The bridge is steadily rising, the road taking shape, and with it comes the promise of shorter travel times, expanded trade routes for fishermen and farmers, and unrestricted access to education and healthcare. As Engineer Momoh noted, this is more than concrete and steel. Is a bridge to opportunity, unity, and economic revival. From there, the team moved to the Okrika-Borikiri Bridge, another legacy project with a turbulent history. Once stalled and yet to the mercy of time, it had become a symbol of unfulfilled promises. Today, under renewed oversight, it is coming alive again. Stretching across the waterways, the bridge will soon connect Okrika and Borikiri with a direct, reliable route, cutting travel time dramatically and breathing new life into commerce, tourism, and community interaction. The minister emphasized that such inspections are not ceremonial. They are a direct mandate from President Bola Ahmed Tinubu to ensure that every NDDC project meets the highest standards and delivers maximum impact. Every pillar we see here is an investment in the economic heartbeat of these communities. The final leg of the tour took the delegation to the Niger Delta Regional Hospital and Auxiliary Building, a project in Port Harcourt, a development set to redefine healthcare delivery in the region. Unlike the abandoned bridges of the past, this project is a bold statement of intent, a state-of-the-art medical complex equipped to meet global standards. It will house advanced diagnosis centers, surgical theaters, emergency units, and specialized wards designed not just to treat, but to save lives. For too long, residents of Niger Delta have had to travel long distances, often to other states for quality medical care. With this hospital, the era will end. It will create jobs for medical professionals, improve response to health emergencies, and serve as a training hub for the next generation of healthcare workers.
For me, these are major legacy projects, so that when they are completed, they add value. The system holds a transportation system and healthcare delivery system. And these are the major plans of the Tinubu administration. Like I told you earlier in the day, I have decided to come here this time around with the Permanent Secretary and other principal officers of the ministry to see what is going on. I do know that the previous time we came, we also saw some, not all that we have seen today. So if these three projects are focused on within this period and they are driven to completion, I'm afraid this will have achieved major feats in this project delivery.
From bridges that reconnect communities to roads that open new trade routes to hospitals that protect lives, the minister's tour was more than an inspection. It was a reaffirmation that the development in the Niger Delta is not on pause. It is in motion and results that will be felt for generations. This is Osigwe Omoh reporting for iReporter Online from Port Harcourt.